Hello everyone, I am Dr. Suyash Kulkarni and today we are going to continue our discussion about diabetes mellitus. Well, in the last discussion, we spoke about diabetes in general, but now I will be describing a little in depth or details about type 1 and type 2 diabetes. Now this is very important. Why? Because type 1 diabetes affects our kids. It is called as juvenile diabetes. All parents are absolutely concerned if their child is suffering from type 1 diabetes. So, what is the age group in which your child can get this diabetes? Generally, two age groups are seen, between 4 to 7 years of age and between 10 to 14. Give or take a year, here or there. But it's very important that you pay attention to the signs which the child can manifest. What are they? Number 1, excessive hunger, excessive urination, irritability, loss of weight. The child, when passes urine or when speaks, you might notice a fruity odor. So these may be few signs or symptoms pointing towards diabetes. So you should get your child checked for the same. Whenever your pediatrician advises, get the blood check done. Don't be hesitant. Go ahead and do it. Rule out type 1 diabetes. Please understand, the treatment of type 1 diabetes is insulin and insulin alone. Why? Because normally our body requires insulin to metabolize this blood sugar. Insulin is produced by pancreas. Pancreas means मराठी में उसको या मराठी मध्ये त्याला स्वादुपिंड म्हणतात. So many people have heard that it is somewhere near the tummy region. Well, this pancreas is very important. So what happens in type 1 diabetes? Well, the body's immune system, your body itself harms the pancreas. There is no known cause. We do not know what the cause is for which the diabetes or the body harms its own pancreas. Sadly, it does. अगर ऐसा हुआ, तो the child will require insulin as treatment. You cannot miss insulin doses because as no insulin is produced, if you stop insulin, providing insulin from outside, the blood sugar levels will go very high, and this is a major complication of type 1 diabetes called as diabetic ketoacidosis. Well, it is not required to be described in detail, but you should understand, and parents with children of diabetes type 1 should read about it. You should never miss your insulin doses. Now, whereas the other way around, type 2 diabetes, this is generally seen in middle-aged individuals. Nowadays, because of our food habits, type 2 diabetes is coming earlier. Maybe it is entering our lifestyles or life in the third decade. Initially, it was after 40 years of age. Today, it can also be seen at the age of 30. Why does it occur? Number 1, most important cause is our diet. We eat junk food. So, obesity plays an important role. Second, erratic lifestyle, erratic habits, food habits. You will have your breakfast in the morning at 8 and then you will have your lunch at 4 o'clock or 5 o'clock in the afternoon, or maybe directly your dinner. So that spoils your body. So you should have a healthy lifestyle like I have described in the earlier video. Now, for type 2 diabetes, we require oral medications. So if your diabetes is under control or is slightly elevated, with simple medications, your blood sugar levels can be brought into control. However, please understand, if you do not control your blood sugar levels, the dosages of the medication at a later date would keep on increasing, and then if required certain times, the patient may require insulin also. Again, with type 2 diabetes as well as type 1 diabetes, you should get your eyes, your kidneys, your feet checked like I have discussed in the last video. Now, if you have any other issues or any other problems related to type 1 or type 2 diabetes, please feel free to contact me. Thank you.